Hi, my name is Dr. Tuan Pham. Let's learn a little bit about the psychology of patients and what they ask. For example, do you emotionally verify what your patients ask? What do I mean? How many times have you seen a patient go to your front desk and then they ask your front desk, do you think I really need this crown? Or should I really do this? What are they asking and what are they saying? Let me explain it to you how important these questions are and how to recognize what they mean to help you increase your treatment plan acceptances. For example, I'll give you a good analogy. When I go to a new restaurant, a lot of times I look at the menu and I see a lot of things that I like, but I can't narrow it down. I do my research, I look on my phone and then narrow it down to maybe 2 or 3 items, and then I'm still not sure. So what do? I ask the waiter or waitress, what is your recommendation? What do you suggest I try? And what usually happens? I usually go with what they say because I don't know any better. It makes me feel good listening to their decision and deciding on what I want. So let's relate it to your patient. Let's give the dental equivalent of it. So, what happens when your patient goes to your front desk and they really ask, Sally, do I really need this crown? Should I really do this? Let's break it down to what it really means. A lot of times we're obviously human. We want to feel good about our decisions. We want to know that what we decided to do is the correct and right decision. So obviously, if your back staff, your clinical staff has done their job and they've imparted the value, educated the patients on what they what they need, okay? Well then, they've done their job and then the patient comes up to the front desk. Well, like I said, we're human. Just as the restaurant, I want to feel good about my decision if I'm unsure about what to decide. And so a lot of times, if your back staff has done their job and imparted the value of what they needed, they already accept it. They understand that, hey, I got this busted tooth. You or the hygienist showed them the picture of this tooth. They understand that this tooth is broken and that they need a crown. So now they just want to feel that emotional verification and validation. This is a very important concept. They want to feel good. They want to feel like they made the right decision in what they're doing. So what do? They ask your front desk, whom oftentimes they view as a third party. They understand that this person works at the office, but they're not the doctor. They're not the owner. They want to ask a third party to feel good and verify that they made the correct decision. So they ask your front desk. And so with this concept in mind, it's very important that your front desk understands this and you teach this to them. Because in the end, it's a win-win situation. Because your patient wants to feel that push. They want to feel like they made the right decision. So what you need to know is, whenever you hear this question, should I do this? Do I really need to do this? This light bulb needs to go off in your head. And if it does, it should remind you that, yes, I need to validate my patient's decision. My back staff has done their job to educate this patient. This patient is ready. And so now, as the front desk staff, I need to say, yes, you absolutely need to do this. And then I need to follow up with why the benefits are. And so I hope this helps you. I hope this helps you understand some of the psychology of what it is when patients ask certain questions. If you like this and you want to learn more, then hop onto my website, www.dentalmaverick.com. Watch the first video for free on the front page. It'll give you an insight into psychology and dentistry of yourself also, and go from there. Thanks very much.